Welcome back to the channel. It's Dr. Durst, and I have with me today my co-host.
Hey guys, Faraday Golembieski, family nurse practitioner here at RevitalyzeMD.
So today we're going to dive into a nasal spray that may potentially give you better erections and make you a rock star in the bedroom again. And so we're going to go into what that spray might be, and if you've ever heard of PT-141, what that is, what the different forms are and routes that you can take it, and how it works, and does it help with ED. So let's get into it. So PT-141, we have a conversation about this
all the time.
All the time. We have a ton of men and women both on PT-141, but this is an approved product, manufactured conventional product for basically hypoactive sexual desire disorder in women.
Yep, and then we use it off-label for men.
Yes, and we actually use it off-label for women too, because it's just one dose, and it's, you can use it different ways and you can adjust it, but it's kind of just a one set dose for women, and it's kind of pricey too.
Absolutely,
if you're doing it that way. Yeah.
But it is a peptide that is FDA approved.
Yeah. And so it is FDA approved for, hypoactive sexual desire disorder. And so, yes, Faraday is correct. We use it for men off label because we use it for better erections. And it improves sex drive as well, and orgasmic strength, which is the big key to PT-141. So what is it? You got back to the fact that it was a peptide, which is an amino acid sequence. And we use peptides all the time and have a large practice that does a lot of peptides.
And sexual wellness.
And sexual wellness. And this one combines very well for the both. So PT-141 is for sexual function and improves sexual function in both men and women. And I always say everyone loves it. It just depends on when. And
I think that's probably the biggest thing with this medication is when to use it, how to use it, when to use it, when does it work, what are the side effects, finding your happy place with it. And that's what we'll get into today.
Correct. So all patients love it in my experience, except again, when means you might get a little nauseated with it. That's an effect that you acclimate to, but also when is it going to kick in and give you a better erection or better orgasmic strength? And so with this peptide, the nice thing is we use it a lot of times subcutaneously, which we're doing a small injection of this peptide into the subcutaneous, which is delivered throughout the body. And again, the timing is an issue. Like, is it going to work in 30 minutes? Is it going to work in 5 hours? And it's variable for everyone. And so every patient has to find their time frame for it and when it works. So,
all right. So Dr. Durst, what is PT-141?
Well, it is a peptide that is going to increase your sex drive. So melanocortin receptor agonist, and that's probably more than you even want to know. But basically, there was a tanning peptide that we would use, and then this was just a small segment of amino acids of that tanning peptide, and that was melanotan. And so this one is the part of that peptide that used to increase sex drive, and so that's how that was brought to market. When it was isolated, they actually, way back, we did a podcast on this that I would refer you back to listen to. It goes into depth on the science of PT-141, but it also talked about how it was brought to market, because the first study didn't go well, and that was a nasal spray. And so what they did was change that to an injection form, and then changed it a little bit, and then got it brought to market for hypoactive sexual desire disorder in women. So basically, this is the amino acid sequence that increases sex drive. And so it does it in a different way than the PD-5 inhibitors.
It's working on the brain receptors instead of targeting blood flow like your Viagra and your Cialis.
So the melanocortin receptors are in the brain. And again, like Faraday said, those others, the PD-5 inhibitors, will increase your blood flow.
And that's going to be your Viagra, your Cialis, tadalafil, sildenafil, depending on your name brand, if you know them, or the generic.
Or the little blue pill.
Yeah.
And so basically, we typically are using it in a shot form. And the thing that we're going to talk about today is the fact that you can use it as a nasal spray. So did you know that you can use it as a nasal spray to increase erections? But you can. And so what are the differences in how it works and how quickly it works?
So
when
you
you're using
administer
it.
directly into the nares. So you spray right into the nose. So the nose is very vascular, so it absorbs directly. And it can start working within 30 to 60 minutes and can last up to 8 to 12 hours. So I say it can start within 30 to 60 minutes, but as Dr. Durst alluded to earlier, for some people, it may be 4 hours until it kicks in. And it can last up to 8 to 12, or it might only last 3 or 4. So everybody is very, very different in how they are affected by this medication for timing for onset and then how long that duration of timing works.
And the big difference between a sub-Q injection and a nasal and administration of this is typically, again, you're injecting it as a nasal spray into the nose, close to the brain, and potentially you have a quicker onset of action, but also it doesn't last as long. So that's typically the pharmacokinetics with PT-141 in a nasal spray. So maybe the duration about 2 hours versus that up to 12 hours and maybe a little quicker. But it is well tolerated and it is highly available. And so it does work in the nasal spray. And so that's the good part about it is you don't always have to inject a medication to get the effects of it.
Even though we prefer it.
Yes. What the
injectable form. It seems to work a
think-
little bit better. We tend to get a little bit better of a response. The most common side effect with this medication is nausea. I think that kind of across the board, that tends to be one that I hear the most in clinic is that there's some little bit of rolling nausea with it after injection. It's not ongoing. It doesn't last 8 hours. It tends to be pretty well tolerated, even that little bit of nausea.
A little bit less likely to get the nausea with the intranasal administration of it. But again, you can also have headaches and flushing with the subcutaneous. And so if what we're saying is true, which it is in practice, that we see a better efficacy with the subcutaneous injection. So just think it probably is a little bit stronger, lasts a little bit longer, and therefore maybe a little bit longer to actually get into the area where it's working, which is the brain. But at the same time, more in the way of side effects potentially with the sub-Q. But the nice thing is you can travel with this. You don't need to have insulin needles. You don't have to refrigerate that. Well, you do have to refrigerate it.
I was going to say, we still got to refrigerate all peptides.
Yes. And so, but what we always say about peptides, again, it doesn't strictly have to, you don't want to freeze, unfreeze, freeze, and they're very fragile. So you definitely don't want to have them in heated environments once reconstituted. And I would recommend that they're actually cool all the time, even when not reconstituted. But the nice thing about peptides is that you can travel with them. You can use like a small diabetic, ice pack, which is what I use with my peptides when I travel. But you can also just have them unrefrigerated for a short period of time. When you get there, you put it in the refrigerator. It's good as long as it's not sitting next to the window with, hot sun.
Leaving it in your
Florida.
car in the center console.
Yes. Yeah, there are things you don't want to do. So you don't want it to heat up too much. But if it's at a room temperature for a period of time, and you'll know that it's still effective because you'll get that flushing typically, the effects that you typically get when you inject it. And so you would get some maybe nasal congestion, some nausea, and a little bit of flushing. So, but it's effective. It just isn't effective if you're freezing, you're cooling, you're freezing, or it's too hot for too long. Or hot at all, but out of the refrigerator for too long. So anyhow, but it works. That's the key. And so who's it for? Again, if you are using a little blue pill or the Viagra Cialis or the generic versions of those or Levitra, you basically can try this in conjunction, and there are studies that show an increased responsiveness of the pills and better erections in
Well, if you're increasing sexual desire, you're increasing that sexual response cycle.
Yeah. Well, and you're hitting it from two different angles. So you're doing a neurologic effect, and then you are doing also a blood flow. And
for vasodilation, increased blood flow.
Yeah. And so that's the reason why that is better, because you're hitting it from both angles. And the thing I like about PT-141, again, my conversations with patients are very simple. You'll most likely really like it. It just depends on when. And then also that if you have that lack of confidence, So basically, you've had some issues with erections and you're, questioning whether you're going to have that issue that time, that this sometimes will give men their confidence back because it affects it from a different route and neurologically. And also, you get spontaneous erections potentially. And again, it isn't something you're going to walk around with an erection and you're so hard you can't, you can't be out in public, but you have a better chance of even just a spontaneous erection without a specific stimulus that produces it, and therefore that gets your confidence back.
Absolutely. And it does increase sexual desire, but it is not to the point that you can't walk around and get things done because that thought process just consumes you. It just heightens it a little bit.
Yeah. And orgasmic strength is higher. So across the board, we hear longer performance times and heightened orgasmic response for both men and for women. So worth a try if you're thinking about it, for sure. So we'll do a study that just talks about, essentially, that was a small study, but it did look at men using a nasal spray and does it work. And there's studies of a nasal spray as well with the PD-5 inhibitors. And basically it does work. The time frame was usually somewhere between a half an hour and 2 hours, and no significant side effects with it. And that was a 7 milligram strength that they were using in that. So no EKG changes, no significant side effects, and it worked. And so they were, it was a significantly higher erection score and report with the study. So there are studies there to support it. And if you're thinking about trying it, my suggestion is that you find a provider that specializes in peptides and give it a try if they think that it is the right choice for you. And so anything else you think we haven't, because we talk about PT-141 all the time.
I know. It's kind of like this is a quick and easy podcast.
Yeah.
It's a nasal spray. It works. You just got to find your dosing and onset time. And that's really it.
Yeah. There are some myths out there, and we're going to do another podcast that just addresses myths in general about PT-141 because there's a lot of them out there. But in general, the nasal spray works. Give it a try, and it's an easier administration. So
if you have experience with PT-141, let us know. If you have any questions about PT-141 we didn't address, drop them in the comments. We can do a quick video and answer those for you.
Yeah. And let us know your experience. Looking forward to it. So let us know if there's anything else you want to get into and talk about as well, because we are willing to deep dive into anything wellness or sexual wellness. Thank you.